Hello everybody, my name's Tanya Pineda. Today I'm so sorry about my raspy voice. I try to hold this PowerPoint presentation for a while. That's why I hadn't uploaded, because I thought my voice by now would be back, but unfortunately it's not, and I'm so sorry that you guys have to hear this. I hope you guys can still understand my presentation, and once again, I'm so sorry about this. But let's get started. So today I'll be talking about two important electrolyte relationships. The first one's going to be sodium and potassium, and the other one's going to be calcium and phosphorus. So these electrolytes play a key role in our health, and as future nurses, it's important that we understand how they work and what to do when there's an imbalance. So to start off, how fluids and electrolytes work. So our bodies use electrolytes to help regulate things like nerve signals, muscle movement, and hydration. They travel through fluids, and our kidneys and hormones help keep everything in balance. If this system gets thrown off, it can lead to serious problems like weakness, confusion, or even heart issues. So we're first going to talk about sodium and potassium relationship. So they have a close relationship. Sodium mainly lives outside the cells and potassium lives inside. They work together using something called the sodium-potassium pump to keep muscles and nerves working properly, especially the heart. If there's too much or too little of either one, it can cause symptoms like irregular heartbeat or muscle cramps. The next one that we're going to be talking about is calcium, phosphorus, and their relationship. So they have like an inverse relationship, so it's a little different. So when one goes up, the other usually goes down. So calcium helps with muscle contractions and bone strength, and phosphorus helps make energy and supports bones as well. They're controlled by the parathyroid hormone and vitamin D. If something goes wrong with the kidneys or parathyroid gland, it can throw the balance off. I'm so sorry. Causes of imbalance. There are many things that can cause these imbalances. For example, vomiting, or diuretics and nausea. They can affect sodium and potassium because we're losing those fluids. Vitamin D deficiency or kidney disease can affect calcium and phosphorus as well. We have to watch for signs like fatigue, muscle weakness, or abnormal lab results if a patient does come in with those symptoms. So now, what are some things that we should monitor? So as future nurses, and just to get in the hang of it, we need to monitor labs and EKGs and give the right treatments like IV potassium or calcium gluconate with a provider's order, of course. We also teach patients about food choices like eating bananas for potassium or dairy for calcium. That's when we incorporate into the care plan. Teamwork with pharmacists and dietitians help us give safe, effective care. That's the whole part of the healthcare team working together to make a care plan. So why this matters? Fixing these imbalances is really important. If we don't, it could lead to seizures, heart problems, or falls. Keeping electrolytes in balance support healing and help prevent complications. So I'd like to hear your thoughts on these two questions that I'm going to be asking you guys. If you guys can answer in the little replying thing down there. So what patient education strategies would you use to prevent sodium-potassium imbalances? What does the parathyroid gland do to help balance calcium in the body? So this concludes my presentation on these electrolytes and their imbalances and why it's important as nurses for us to monitor them as future nurses. These are the resources I used for today's presentation. So yeah, thank you so much.